Hey, Adab, Sat Sri Akal, very good evening. Namaste, Adab, Sat Sri Akal, greetings of the day. Today I'm here with the topic Paraffin bags applications. आज हम बात करने वाले हैं पैराफिन बैग्स को थेरेपी एज अ थेरेपेटिक पर्पस कैसे यूज़ कर रहे हैं, उसके क्या एप्लीकेशंस हैं, क्या यूजेस हैं, क्या कॉन्ट्रा इंडिकेशंस हैं एंड इंडिकेशंस क्या हैं. सो लेट्स स्टार्ट. अबाउट द इंट्रोडक्टरी पार्ट ऑफ द पैराफिन बैग्स को ही हम पैराफिन बाथ भी कहते हैं. पैराफिन बैग्स इज सिंपल, कन्वीनियंट, reasonable, efficient method of applying conducted heat to the extremities. It is a combined immersion technique with paraffin bags and mineral oil for conductive heat gains. Therapeutic uses 7 unit of bags, 1 unit mineral oil will you combinedly will used as a therapeutic purpose. The paraffin bags is then kept at low temperature and remains warm for longer time than water. Now, it is working on the method of heat exchange that is called as conduction method. In the case of paraffin, it provides superficial heat with a deep or depth of 1 centimeter of the targeted part. Now, we are going to discuss about the characteristics of paraffin bags. So, first characteristics is has a slow thermal conductivity, slow heat diffusion 6 times lower than the water. Paraffin bags has a low melting point at 55 degree. When the oil is added, that the oil we are talking about mineral oil, as we talked earlier about that. The paraffin will remain at a temperature of 40 degree to 44 degree centigrade. This low specific heat will enhance the patient to tolerate heat from the paraffin better than from water of the same temperature, and it helps better tolerance to heat for the patient. Now, the second characteristics of paraffin bags is self-insulator. It gives moist heat. There is a layer between the skin and the bags, producing heat and sweating which does not evaporate. After removal, the heated part cools quickly by evaporation method or approach. Now, the third characteristic or a feature of paraffin bags therapy, it is an analgesic. This insulating layer keeps the heat and is effective in relief of pain. There are the few pictures about the paraffin bags bath modality and the paraffin bags tubes. Now, what was the operations of the apparatus? Paraffin bags has a melting point of 55 degrees centigrade. A large bath have a capacity of 25 kg of paraffin. Then we can add 5 liter water of light petroleum oil to lower the melting point and prevent burn. To melt the paraffin, turns the switch on to heat the coil and the water for 1 hour prior to treatment. Always check the temperature with thermometer before treatment. The patient body parts should be cleaned before treatment. We have to careful when we apply these type of techniques or modalities like paraffin bath apparatus. So we have to careful about the other debris or other insulated part available over there. So we should clean the targeted area of the body of the patient. Bath is to be cleaned regularly every 6 months while the paraffin is liquid. Disconnect the unit from the electrical outlet and dip the paraffin out of the bath with a small pan in another container. Remove and clean the slits. Remaining paraffin can be removed and sediments removed with paper towel. Replace then the paraffin bag in the bath and add new paraffin is needed. Now, what was the physiological responses to paraffin bags therapy? Physical responses क्या होंगे paraffin bags therapy के? So first physiological response is heat production. In the first 2 minutes, a marked increase in skin temperature. While we applying the first 2 minutes, temperature of the skin is increased 12 degree to 13 degree centigrade. While wax wrapping, the temperature drops gradually. Then after 30 minutes, at the end of the treatment, 8 degree centigrade at skin level, 5 degree temperature at subcutaneous fascia, and 2 degree to 3 degree in superficial muscles. They are the categorized or the temperature, approximate temperature of after the treatment as per the heat production. Now, second physiological effect is circulatory effect of the paraffin bags. Stimulation of superficial capillaries and arterioles at the local hyperemia reflects vasodilation of capillaries in the skin, reflects heating of the joints. Skin temperature drops quickly after 15 to 20 minutes, reduce then vasodilation. Exercise after bags is important to increase range of motion and muscle strength. Now, the third effect, physiological effect, is analgesic effect. Most important effect as sedative effect on tissues of the paraffin bags. Moist heat gives a soothing effect, and prior to the exercise for superficial joint, it gives very effective as an analgesic. Now, the stretching effects. Bags leaves the skin moist, soft and pliable. It is useful for stretching scars and adhesion. Basically, to remove the adhesion or scars, stretching is the one of the most preferable after the paraffin bags therapy. Now, what was the indications of the paraffin bags therapy? So, first indication is pain or muscle spasm, edema and inflammation, post-traumatic swelling of the hands and feet, swelling of the hands in rheumatoid arthritis also, swelling of the hands in degenerative joint disease also, and subacute and early chronic stage or inflammations of the arthritic pain and swelling. And third indication is adhesion and scars. Basically, paraffin bags helps to facilitate the mobilizations and stretching procedure. Now, so most important part, we should careful about it and definitely to get to know about the what are the contraindications of the paraffin bags therapy. In electrotherapy, we should always remain keep in mind contraindications as more important than the indications also. So first contraindication of the paraffin bags therapy is impaired skin sensations, hot or cold sensation test, and in like conditions like anesthesia or hyperesthesia or paresthesia. Some dermatological conditions like dermatitis report any reactions after treatment also. And circulatory dysfunctions are the completely contraindicated for the paraffin bags therapy, that is varicose vein, deep vein thrombosis, arterial diseases, and many more. Analgesic drug is also contraindicated as pain tolerance to heat is impaired sometimes. The fifth contraindication is infections and open wounds as it increases the infective activity such as in blood-borne infections also. Now, sixth contraindication is cancer, tumor or tuberculosis in the area of the treated as it increases the metabolic activity and rate of growth. Eighth or I can say seventh contraindication is gross edema with a very thin and delicate skin covering the area. Lack of comprehension, children, senile, head injuries and confused population. Deep X-ray therapy within the 3 months prior to treatment decreased blood flow, thus impaired sensations also. External or internal metafixators or metal fixators, I can say implants also. Metal plates in orthopedic patients are the completely contraindicated for the paraffin bags therapy. So what are the advantages of paraffin bags therapy? So two or three patients can be treated at the same time. useful for patient with poor heat tolerance, dry scaly skins after plaster of Paris removal. Third, it can be followed by therapeutic exercises also, and it carried out at home also. Wax can mold around the bony contour of feet and hands. It is applied evenly by conduction. Disadvantage of the paraffin wax is also so that is not sterile or not very disinfected procedure. Messy technique. Floor should be protected and sedimentation occur in bottom of the bath or the tub should be regularly cleaned. So it needs more time. It's consumed time to maintain. Contamination by air unless covered by lid. Water collect at the bottom of bath or the tub. Now the techniques. There are number of techniques for the application. So first technique by dipping. Create paraffin glove by 10 repeated dipping. Finger are in abduction. Don't tip above the level of the previous glove. Second technique by immersion. Dip once for having a glove, then immerse for 15 to 20 minutes. Never immerse at first for a long time without making a glove. Dry before to have insulation. And third technique is paraffin bags with infrared cabinet. So, same as technique previous discussed, that dip and second that, and place in heat cabinet at 70 degree centigrade or under infrared lamp at 0.5 meter distance. They are the third technique. And the fourth technique, tray technique. Dip twice, then immerse for 15 minutes and remove the hand and place in a tray containing semi-liquid paraffin. Ask patient to move hand and make shapes out of the solidifying bags. And fifth technique is paraffin with elevation. Same technique as first, then place the hand in elevation under a hot air cabinet. Alternately, the hand can be placed in elevation with a towel or blanket wrapped around hand for 20 minutes. Sixth technique is bandaging. Bandaging is now most preferable and practicing nowadays. Bags can be also applied to the knee and elbow by applying elasto crepe bandage which have been immersed in bags, then brushing more bags on the bandage using a paintbrush. So again, I'm just summarizing all the techniques one by one. Technique 1 is dipping. Technique 2 is immersion. Technique 5 is elevation. Technique 6 is with bandaging. And the solve for today. And I'll definitely meet you soon with the next upcoming topic. Thank you. Have a good day.